Hi, my name is Paige. I'm a nurse at the Wilmot Infusion Center, and I'm going to show you how to change a PICC dressing today. So we're going to start by taking off the 7-day-old dressing. You want to make sure that the dressing is changed every 7 days unless it's been lifted on the edges or if it's been covered in dirty drainage or blood. If any of that is soiled, it needs to be changed before the 7 days. So we're going to start taking this off here. I have clean gloves on. Got my clean work surface already set up. We're always going to pull up towards the insertion site in the biopatch. And if you want to start just taking this off while the dressing is anchoring your line down, it makes it a little bit easier. You can lift this up first, and usually you remove this with alcohol. It says it on there as well, so it's pretty sticky. Just makes it a little easier. Comes off. And then these retainer doors just snap open. Using your thumbs, you'll lift up. And you only want to lift this up, not side to side. You never want to pull on it. Lightly place that down. And your biopatch should just come right off with the dressing. And a good way to keep this dressing change and the line anchored is you can always use paper tape or a little strip that comes in this stat lock packaging. But you want to make sure you're anchoring it where you're not going to be using sterile technique here. So that way it'll just keep it in place. Now that we have this open, we want to assess the insertion site for any purulent drainage, swelling, redness, irritation. Palpate above the insertion site, make sure there's no irritation or soreness. If you do find any of these findings, you want to document it in the patient's chart. Let the PICC team know and your provider know. If there is drainage, they maybe want to order a culture and culture the site. Always make sure that's in your patient, documented in your patient's record. If there was gauze underneath this dressing as well, you would want to change that within 48 hours of placement. That's as long as it can stay under the dressing. So now that I have everything removed and now I have my sterile field set up, I'm going to take these gloves off and put clean ones on, and then we'll get started changing the dressing. All right, so now we're going to clean with chlorhexidine. Make sure it's all good to go. And you want to scrub in a back and forth motion for 30 seconds. And you want to scrub vigorously because that is what is going to get all the germs off. And you want to scrub the entire area that the dressing will be covering. You want to make sure you get underneath. That's why it's good to have this anchored down during the scrubbing. And then once that is completely covered in chlorhexidine, you want to do this for about 30 seconds. You're going to allow it to completely dry. About 30 seconds, it usually takes longer than that. So now that everything is clean and dry, we have our sterile field set up. I have my sterile gloves on. I have a mask on and the patient has a mask on as well. That's very important. And anyone in the room during the dressing change also has to have a mask on. So now we are going to grab our skin protectant here. So this goes where the securing device is gonna be. So you're gonna scrub this on the skin to help adhere the securing device, but it's mostly to protect the patient's skin. So once we apply that, it's gonna completely dry. It takes about 10 to 15 seconds, but sometimes longer than that. You always wanna make sure it's completely dry before you move forward. So now that we know it's dry, we're gonna grab our stat lock, and it has these retainer doors on here. You're gonna wanna loosen those up. And then the wings on the back, you're gonna wanna pull to the side. And I already have this anchored down with the non-sterile side. And you're gonna very carefully lift this up and go underneath. Do not wanna pull the PICC line. You just can lift up. And you wanna put the wings right into those holes. You're gonna snap in the retainer doors first before you adhere it to the patient's skin. Just like that, and you're gonna pull down. Just like that. Now that that is in place, we are gonna put our bio patch on. It has this slit here. You're gonna want that slit to encircle the insertion site and go kind of just right underneath if you can. Now that that is in place, we'll apply our dressing. And this needs to cover the entirety of the insertion site in the bio patch and as well as the stat lock. Pull this off. And place over. And then next you're going to want to take this part off. We call it the pants. And it's just to help. You can also take your strip off here. This helps secure the lumens, so it keeps them in place. And now that that's more secure, you're gonna take date, time, initial, and call this part the belt, and you'll just put it right over here to help secure those lumens. And you are all set. So now that our dressing is changed, we want to make sure that's documented in our patient's medical record. And that has to be done every 7 days. So put in when is due to be changed next. Now that that's done, we're going to measure. We're going to measure our antecubital, our upper arm, and the external length of the PICC. So first I'm going to start with the antecubital. Bring it to 0 here. Lift up and around. And then we have 22. So to measure our upper arm, this is all done in centimeters, all these measurements. We're gonna start at the AC where our 0 is, and we're gonna go up 10 centimeters. At the 10 centimeters, we are gonna measure the upper arm of the patient. And I got 22. We're gonna plug those numbers in. If those numbers change within 2 centimeters or greater, you are gonna want to notify the PICC team and the provider. And then lastly, we are gonna measure our external length, which we measure from the insertion site of the PICC line to the beginning of the purple butterfly wings. So what you're gonna do is count. If you can't count all the tick marks, if this bio patch is, in your way, another good way to do it is with your measuring tape. You're gonna start at the 0 and you're gonna measure from the beginning of the purple butterfly wings. So I have 3 centimeters. And we're gonna document that in the patient's chart as well. If this measurement has changed at all, whether it's moved from 3 to 2 or 3 to 4, that has to be documented, and the PICC team and the provider has to be notified of any changes. So I wanted to show you how to change a dressing properly if you have a patient who has a secure cath in place. That is this orange triangle here. So what you're going to be measuring here is a little different than when there's just a stat lock. You still want to measure from the insertion site to the beginning of the purple butterfly wing to measure the external length. I want to show you how to do that measurement. And you're going to start at the insertion site at 0 and go to the beginning of the purple butterfly wings. So we have 4 centimeters. The insertion site to the beginning of the secure cap is 3 centimeters, and it will always be 3 centimeters. So any additional ticks after that, you will count and add to the 3 centimeters. So we have 1 tick after here, so it gave us 4 centimeters. So if any of your patients have an allergy to chlorhexidine, then we are unable to use this BioPatch and also the chlorhexidine scrub that comes within the central line dressing. So if they have a chlorhexidine allergy, you're going to want to use povidone iodine swab sticks. There's 3 in here, and you will take 1 out sterilely individually. And you will start from the center and move to the periphery in a circular motion and use friction with that. And you would let this completely dry. This takes about 2 to 3 minutes sometimes, so don't move forward until everything is dry. Also, in place of this BioPatch, we would use what's called an Algidex patch, or also known as a silver patch. So this has a silver side to it. So the silver side will be placed down onto the patient's skin. And that is what we would use in place of a chlorhexidine allergy. If your patient has an allergy to the transparent dressing that's used here, then we're going to use what's called an IV 3000. And it is an orange dressing. And that is going to be in place of this.